Good day. We are Ashley Fajardo and Isabel Peralta from PT1C, and we will be presenting our case for today. Next. The case that was given to us was a 2-year-old female patient who came to rehab with a sling on her right arm. Her caregiver reported that she frequently held the patient's right hand, only whenever they tried practicing walking. When the patient tripped one day, the caregiver heard a loud popping sound upon saving the patient and was immediately brought to a hospital. Soon after, the patient was diagnosed with nursemaid's elbow.
First off, for the mechanism of the injury, next, nursemaid's elbow or radial head subluxation is an injury in which the radial head slips under the annular ligament when there is a partial separation of the radiocapitular joint, resulting in pain and inability to supinate the forearm. Next. It is a common injury among children ages 1 to 4 and occurs due to a sudden longitudinal traction applied to the hand with the elbow extended and forearm pronated, which can happen when a child is swung around by the arms or lifted by one arm. In the case provided, the injury may have occurred when the caregiver saved the patient from falling by mindlessly pulling the patient's arm as indicated by the loud popping sound. Less common mechanism of this injury also include falling onto the elbow or twisting of the forearm.
Next. Next would be the different structures affected by the patient's condition. First is the head of radius or radial head. It is located at the most proximal aspect of the radius bone, and it's a rounded eminence by which the humerus articulates with the radius. Second would be the annular ligament of radius, which is a strong band of fibers that encircles the head of the radius and retains it in contact with the radial notch of the ulna. It stabilizes the radial head as it rotates during supination and pronation of the forearm. Its external surfaces receive attachments from the elbow capsule, radial collateral ligament, and supinator muscle. And lastly, the radiocapitellar joint. It is located between the radial head and the lateral condyle of the humerus, which is less constrained and allows both flexion, extension, and rotation of the forearm. Next. And for the last question regarding the possible impairments the patient might still suffer from after reduction, there's a huge possibility of recurrence of such condition, especially in patients younger than 3 years old, as their anatomical structures, such as their joints and ligaments, are not yet fully developed. Another could be an overstretched or inflamed annular ligament that may lead to sprain or worse, ligament tear. Ligament sprains are caused when the fibers become stretched or torn, or even when a ligament completely ruptures. These can be classified into 3 grades.
Grade 1 is a stretching of the ligament or very mild tear. There is little to no instability of the joint resulting from this type of sprain, and whilst there may not be much pain or inflammation, a mild sprain can increase the risk of re-injury. Grade 2, it is a more severe but still incomplete tear of the ligament. This results in some joint laxity or loss of stability. Swelling and bruising are usually present with this grade of ligament injury, and the use of the joint can be difficult. And grade 3 is a complete tear or rupture of the ligament. This will result in severely swelling, bruising, and bleeding under the skin. As a result of a grade 3 ligament injury, the joint is unstable and unable to bear weight, resulting in a severe loss of function. And that concludes our report. Thank you for listening. We are now open for questions.